Okay, I think we'll begin. Well, good afternoon, everyone, and thank you all very much for joining us today for today's webinar, which focuses on managing people risk, motivating employees following the COVID-19 pandemic. My name is Stuart Mangan, and I'm from the Professional Indemnity team here at Marsh. I'm delighted to see so many of our clients and some of our prospective clients join us for this session today, which I hope you will find to be both interesting and informative and thought-provoking. So just over 3 months have passed now since we went into lockdown around about the middle of March. And since that time, I know we certainly at Marsh, and I'm sure you and your respective organisations have been planning for the gradual process of returning to the office. So if we were to look at this in terms of 3 phases, we've been through the initial crisis management response stage, and we're now probably in the second stage of actually supporting employees in their well-being and looking more closely at their work-life balance. The third stage then that's fast approaching for us all to consider is how we might need to reinvest and think about the selection, recruitment and retention of staff as part of our HR strategy, and aligning that with our flexible working practices and changes and adaptations to our workplace benefits as well. On that note, I'd like to introduce you to our 2 speakers for today, my colleagues from Mercer Marsh Benefits. Firstly, we'll be hearing from Wolfgang Seidel. Wolfgang will be sharing with us his thoughts on managing employee mental health. And then secondly, we'll be hearing from Stephen Hempensall, and Stephen will be taking us through some ideas around employee benefit planning and how these might like to be shaped and adapted to meet the future workforce demands. I appreciate there are lots of these webinars and Zoom meetings, etc., flying around at the moment, so we've intentionally kept this as brief as possible, hopefully keeping to 45 minutes for you, including questions at the end. We've had a number of questions submitted in advance of the session today, but I would encourage you to submit any that you may have as we go through via the Q&A tab at the bottom of your screen. If we can't get through any of those today, we'll do our very best to come back to you as quickly as possible after today's session. So I now turn to our first speaker, Wolfgang. Thank you.
Welcome everyone, and thank you for joining the conversation today about health and well-being, which is such an important topic because we live through this global emergency, but we are reminded of what really matters in our lives, and that's health, and not just physical health, but also mental health, and that's on top of the list. When even before COVID, when researchers asked people about what explains life satisfaction, people said mental health first, then quality of work and relationships. So you see the 2 are linked. There is, of course, an opportunity also here now to turn adversity into something more positive, as employers are realizing that they are at a crossroads to transform their workplaces in ways that genuinely allow people to thrive at work, and which will also allow businesses and society to thrive. And that's why probably the title was chosen also about work-life balance. But you see in front of you a slide that's unusual at the beginning of any of my presentations, going straight into line manager training. But that's because uncertainty needs leadership. And we talked about line manager training because 84% of managers agree, and that's data from our mental health at work survey that we jointly deliver with BITC. 84% of managers agree that their behavior affects the well-being of employees. But our mental health at work survey also reveals that 70% of managers state that there are barriers in their organization to providing mental health support. And only 11% of them, in the UK at least, have received training on understanding workplace stressors. So that's really crucial here because everybody now expects 2020 data to be even more pressing in terms of anxiety disorders, depression, domestic violence, loneliness than they were before. And they were quite significant before the COVID crisis already. So hence we at Marsh and Mercer, we received a number of inquiries from clients. Actually, we were inundated with inquiries about manager training and mental health. And as you can see on the slide, mental health training for managers is all about spotting the early warning signs of troubled employees and being cognizant of appropriate referral routes. We teach managers the necessary empathy skills and the advanced understanding of duty of care, which is more important than ever before when managers have to run teams that are remote and so on. And you might be surprised and say, can we really learn empathy? And yes, we can. And what's more, empathy means meeting people where they are, which is hugely important in management, but also in sales and hence business performance. I shared a platform once with the late Stephen Covey, who wrote the 7 Habits of Highly Effective People. And he asked an audience of 500 company directors like yourselves, how many of you feel that your colleagues reached their full potential? And only a dozen out of 500 hands went up. And his follow-up question was, but how many of you had more than 2 days training in advanced empathy skills? So for me, as a trained psychiatrist, that was a light bulb moment, because the business guru put the same emphasis on empathy that I would have put on it. So we also teach managers to recognize links between stress, good management practice, well-being and productivity, and their role in organizations. Flexible working is another one I already alluded to. It's here to stay for a bigger share of the employee population than before. And yet it's interesting, there has been a controversial debate over the last 10 years or so, whether it's more or less productive. And I chair the International Health and Wellbeing Network, and I asked my members recently about exactly that question, and their answer was unequivocal. They said that agile working has now been tested, and they find it has more advantages than disadvantages. And they found that their staff was either more or equally productive than working in the office. Now, that of course is based on this ad hoc assessment, and more research is needed, but there will be time for that. So definitely flexibility will be a more prominent aspect of the new ways of working, and that's a lot to do with work-life balance as well. But a new form of leadership is needed, and it is emerging. So you will probably forgive me to say that if you use COVID as an example again, we did see that compassionate leadership demonstrated by often female leaders of countries, including New Zealand, Germany, Taiwan, and Finland, shows that there is much to be said for decision-making based on the principles of care and benevolence. And this type of decision-making is known as ethics of care, which brings huge social, business, and economic benefits. Because when the group thrives, the individuals within the group thrive as well. Plus, I would say that a major study into the link between well-being and productivity also shows that employers who prioritize employee health and well-being are up to 10.6 days more productive per employee than those that have just average well-being programs. Why do I put this very exact figure there? Well, Stephen will show you a slide later from the survey called Britain's Healthiest Workplace that we deliver together with Vitality Health. And that shows that that's the difference between an average performing organization in terms of health and well-being and the upper quartile. So now, having set the background to this conversation, I would like to move to the next slide now and show you the mental health stepped care pathway. And that's quite relevant because during the pandemic, we saw that organizations that had good health and well-being programs found it easier to deploy the right resources at the right time, not least because they had good pathways in place, not just for mental health, but for other issues as well. In the case study in front of you, we were asked to undertake a review of mental health management within a financial services organization, actually, because the cost of psychiatric claims went through the roof. And that will happen again, because we do expect an avalanche of cases. I just had a conversation before this broadcast with a consultant in the NHS, and she agreed with me that there is a great number of PTSD, post-traumatic stress disorder, coming through from frontline workers, but it will take a little while because as doctors, we are trained to sort of keep hanging in there until there is time for a bit of relief. And other frontline workers in your industry as well will have suffered similarly. So there was a lack of integration in that organization between providers, even though they had anything and everything money can buy, from private medical insurance, income protection, EAP, occupational health, you name it. But there was a lack also of cohesive data coming across, and we designed a pathway which incorporated a gatekeeper assessment and integrated referral service to ensure a seamless transfer of cases and the right level of treatment at the right time, a ring-fenced group of EAP counselors and psychiatrists who also understood the work environment of their clients, because that's quite difficult sometimes to find clinicians who understand the world of work you are in exactly in your industry sector. Now, if you go to the next slide now, please, you will see that the outcome that they calculated was quite positive. So in the first 2 years post-implementation, there was a 9% reduction in the number of mental health claims in the healthcare plan and a 16% reduction in the average cost of claims. Sickness absence decreased by a staggering 41%, but most importantly, therapy outcomes improved by 60%, sorry, as you can see on the slide. So this is just for me making a plea that it is time now, as my clients keep telling me, to move away from the reactive phase where we just had to respond to the acute phase of the crisis and how our business continuity plans work, how our people risk aspect is being catered for, and how we are dealing with the tip of the iceberg of the mental health crisis. So now I want to sort of talk a bit more about what we could do to prepare ourselves. And on the next slide, we talk about EAP as well, which is of course something that most of you have, employee assistance programs, 24/7 helplines, where you can talk about a lot of issues that are quite relevant in the current situation, like the counseling helpline is the first port of call for anxiety issues or depression, loneliness, but also for people working from home. We have to think about domestic violence, which is one of the big downsides of working from home, apart from the fact that there are some extrovert employees who really hate being at home and missing the office and missing the opportunity of bouncing ideas off each other. But a silent majority actually quite enjoys working from home because it gives them more control over their workflow. But the EAP also provides guidance in financial and legal matters. And I know there's quite a few law firms on the call as well. So certainly not in any depth close to what you are doing. They don't provide legal advice, but they provide legal information. And on financial security, they can provide a bit more. Many of them have fully fledged insolvency practitioners on staff who can help employees with debt issues and so on. At least it's a sort of good first access point for various issues, not just mental health issues. And those pieces of information of financial and legal info can also serve as a low stigma entry into counseling, because for some parts of your population, it's not easy to admit that they want and need counseling. But also what EAPs provide is bereavement support, which unfortunately is highly relevant in this context, and so-called critical incident services, which means that they can help you with employees who are affected by the death of a colleague or other incidents like a pandemic, or as we had it with terrorist attacks as well, or worksite accidents. Now, how do we move on from just being reactive to mental health issues and to make our health and well-being program a bit more proactive and more systemic and strategic? So if I could have the next slide, please, that would be great. What you see here is a number of data sets that you already have, and that would help you create a data-driven strategy. And Stephen will home in on that data, as I mentioned before, by sharing with you what we see in your industry sector in the Britain's Healthiest Workplace Survey. But here you can see that we have health insurance data that tells you probably that there's a lot of musculoskeletal issues. You have sickness absence that probably talks a lot about short-term absence and colds and flus. And then you have long-term disability, where you probably find that mental health has overtaken musculoskeletal, and a number of other data sets. So we need to cross-reference the data to avoid a lopsided strategy, so that we are not jumping to conclusions by just looking at EAP data or just looking at at medical plan data. So the dashboard provides a quick and thorough overview of the employee population status of health, but also associated costs. And that's all really important because we are really hard pressed now coming out of the COVID crisis to enhance productivity. And that's why it's also important to be cognizant that health is of course linked to productivity, and very much so. So productivity is a function of health and engagement, to be precise. So that would take us then to a cost benefit analysis and also to predictive modeling as to where the implications of what we are seeing is going. And if we go to the next slide, we can also see a link between health and well-being and diversity and inclusion, because you see in front of you 4 buckets of employees, those who are still healthy and those who are at risk being the biggest group, and then those who are manifestly sick. And most organizations incur high costs for the treatment of employees suffering from ill health in terms of insurance premiums, but also in terms of productivity loss, absence, and presenteeism. But only health insurance claims ratios and absenteeism are visible. And they tend to be just a proportion of 5 to 25% on the right-hand side of the wellness barrier in the slide in front of you. Whereas the other costs are hidden, and they are the vast majority. So 75 to 95% of employees are either healthy or at risk. And it's not rocket science to predict that if we do nothing on the left-hand side of the wellness barrier, people might just move into the low risk, high risk, medium risk, and ultimately claimants of tomorrow category. So you will be pleased to hear that I'm summarizing now on the next and last slide before I hand over to Stephen. And that is sort of my learnings from having done that job for a long time and being a doctor, but also someone who did a lot of return on investment studies and calculations, that I think the time of just following anecdotal evidence is over. And most employers have now reached a crossroads of maturity where health and well-being at work is about to move from haphazard and uncoordinated programs to more strategic ones. So going forwards, showing the caring face of the organization isn't about giving people free fruit or the odd day off or the opportunity to take part in one-off mindfulness sessions. That clearly didn't help us during this crisis, but it is about recognizing the need to design work around human needs. And the future requires that strategic and evidence-based approach based on meaningful data. Not big data is not needed, but meaningful data is needed. And for example, research carried out by Google found that psychologically safe teams, that takes us back to the beginning of the conversation about psychology. Psychologically safe teams where people could bring their whole selves to work and invest really what they have to give to their organization without being afraid of being ridiculed or in some other way discriminated, those teams exceed targets by 17%, and I was talking about productivity. We really need something like that in terms of productivity boost right now. So that all requires, of course, an integrated understanding of people's needs as well, ranging from their financial well-being and sense of belonging on the one hand, to their ability to balance work and life on the other hand, and to drive a sense of purpose from work, which is really also important to keep your spirit up if you can identify with the purpose of your workplace. So I would argue that we need to embed our health and well-being practices in the culture of the organization. We call it a culture of health, and integrate concepts like good work and work-life balance. And last but not least, and as I mentioned it earlier a little bit in passing, health and well-being must be recognized as a new frontier in the diversity and inclusion discourse. Again, something that came up very strongly over the last couple of months. And the data is very clear. Men and women use healthcare services very differently. And also the epidemiological impact on BAME employees, younger and more mature employees, is not the same for many important illnesses, not just COVID, but many other illnesses like cancer as well. And Stephen will sort of elaborate a little bit more now on what it means for your suite of benefits in the organization. And thank you for your attention so far.
So yeah, thank you for joining, and yeah, we're very pleased you've been able to attend today. So building on the need for a healthy, resilient and productive workforce, I would like to talk about engaging and motivating employees while wrestling with financial restrictions and using your benefits offering to manage people risk and reduce cost in the business. We believe it is essential for insurance and risk managers to connect and collaborate with HR to ensure people risk is addressed holistically and as a business interruption risk. And applying an enterprise risk management approach to health and benefit offering can mitigate your people risk and drive considerable value for your business. In a Mercer study earlier this year of 1,600 firms, the health of employees was the #1 priority in their planning and exit strategy recovery from the pandemic. So today I'm going to cover 3 key areas that offer opportunities to engage and motivate employees whilst managing cost. The first is understanding the health of your employees. And as you can see on the current slide there, Wolfgang's explained the most effective health, wellbeing and benefit programs need to be data-driven, targeted and strategic. So in order to make evidence-based decisions, we need to understand the needs and health of our employees, and particularly relevant when faced with an aging workforce that needs more support to be healthy, to continue working and being productive. Now, our unique research into the health of employees through Britain's Healthiest Workplace, which is the largest study of its kind into employee health in the workplace, shows the health risks of the professional services sector in 2019 and its impact on productivity. And naturally, we expect many of these risks to be higher now in 2020 following COVID-19. Now, Wolfgang mentioned the importance of mental health, and you can see across the bottom right of this slide the scale of the challenge in the mental health arena. And these are the average results. We've had some firms in the study that have shown well over 70% of employees suffering from work-related stress and well over 10% of employees with serious financial concerns. However, poor nutrition on the top right of the slide, with almost 64% of employees not eating the right foods and 31% of employees not exercising enough with a lack of physical activity, will also contribute significantly to a workforce that is not as fit, healthy, engaged or productive as it could be. And on the left-hand side, you can see the result of the combination of the absence and the presenteeism in the sector is a loss of productivity of almost 38 days per employee per annum. And that equates to over 14% of payroll, which is a significant cost to any business, as you can imagine. However, a robust, targeted and integrated approach to health and wellbeing does bring results. And on the bottom left, you can see that the top 5 performing firms in the study have higher productivity and lower health-related costs by as much as 28% when compared to the professional services sector. And 60% of organisations that have participated in this research more than once have improved their performance and hence demonstrated a reduced loss of productivity through healthier employees and improved ROI for the business. So we would really encourage you to analyse the health data that you have available and understand the key risks and trends so you can target those and improve productivity and get better value for your spend. So if we can now move to the next slide, please. So in terms of benefit strategy, we said earlier that benefits need to be fully integrated with health and wellbeing in order to be highly effective. Now, we are in very much a new world, and organisations need to be asking themselves if their benefit programme is still fit for purpose going forward in a post-COVID world. So does your programme offer enough focus on health and access to healthcare now to keep employees healthy, engaged and productive? And as Wolfgang mentioned, we're expecting a significant increase in mental health risks and employees needing support, and also a rise in physical health risks where employees have been less physically active over the last few months. And furthermore, there will be a delay in NHS and private treatment, causing an increase in health conditions where there's been a delay obtaining the right levels of treatment. So there's an increased need to support employees quickly. And Wolfgang mentioned the need to review and utilise employee assistance programme EAP offerings. And we certainly see an increase in the usage of telemedicine, as you can see on the left there, with virtual GP and treatments being offered which is video GP consultations and physiotherapy sessions now as well. Because employees will be less likely to want to have a GP appointment or able to face-to-face. So in order to avoid increased health risks from delays in diagnosis and treatment, virtual consultations can ensure employees get diagnosed and treated quickly, increasing the likelihood of a swift return to work. And this is increasingly available through healthcare providers. So if you do not offer that cover already, it's definitely worth exploring an extension of that with your providers. Cash plans are also low-cost benefits that can be included and can include virtual GP access as well. So worth considering. In terms of lifestyle benefits, a lot of professional service firms have moved already from traditional to more lifestyle-related benefits, which is great. But there's still, I think, more work that can be done there in terms of offering benefits which can be much more impactful for employees now and help to reduce absence and claims. For instance, from a financial wellbeing point of view, you saw from the earlier slide that 8% almost of employees have a lot of financial concerns, and that will be higher now post-COVID-19, so more support required there. And from a financial education perspective, that's certainly becoming increasingly prominent in benefit offerings and helping employees to understand their finances and make more informed decisions, and facilitating access to things such as short-term loans at more competitive rates that are available on the open market. And personal insurances and retail discounts as well can be offered, which gives significant savings to employees over the course of a year. Benefit redesign is another area that we're seeing a lot of activity in now. We're seeing a lot of professional service clients coming to us asking to review for, as I mentioned earlier, to see whether it's still fit for purpose. A couple of areas in particular are those that potentially have legacy dependents, death in service pension liability benefits that are offered. And we're looking at converting those to lump sum life assurance benefits, because the market for dependents, death in service pensions is shrinking considerably, and with low interest rates, the cost is increasing significantly. And this benefit can be converted to an equivalent lump sum, which is more flexible for employees and their dependents, and also much cheaper to access the market with a larger number of providers in the market, so it's cheaper for you to purchase. And we've looked at also analysing the market, and you can have significant savings in premium, which can be as much as 20 to 30% of the cost, depending on the actual design that you arrive at. Ill health early retirement or insured income protection benefits are also being reviewed. If you still offer an ill health early retirement pension through a pension scheme, then that can be insured and converted to an income protection benefit, which can reduce liabilities and cost significantly. If you've already got that insured, then you can perhaps look to limiting the claim payment term. So rather than having that running through to retirement age, it can be restricted to 2 years or 5 years in payment. And that can have a significant saving of 40 to 50% of premium, which can be used to release budget on other more immediate health benefits that are needed now. In terms of choice and flexible benefits, we also see an increasing move to offering employees more choice and more flexibility to decide and choose the benefits that are right for them. So much more on a personal level. Examples such as voluntary critical illness are increasing in popularity and will continue to increase post-COVID as well. So moving on to the next slide, please. And we talk about engaging employees. Communication is absolutely critical in terms of engaging employees, and easily accessible, personalised and impactful communication is key to really driving habit change. And digital and particularly mobile enabled communication will have a major part to play going forward. The explosion in social media over the last few years, and certainly the last few months, means that far more people are now engaging with digital communication than ever before. And two key areas where digital communication can really help employee engagement are benefit communication and your wellbeing experience. In terms of benefit communication, it's interesting to understand just how confident you are that your employees fully understand the benefits that you're offering. The Britain's Healthiest Workplace research we referred to earlier on shows that on average, professional service sector employers offer 38 health interventions and benefits to employees, whereas on average, employees are only aware of 30 of those and utilise only 22. So that shows that there is some value for the spend on health and benefits. However, employees are not aware of 21% of the offerings available, and 42% of them are not being utilised at all. So still some way to get real value. And it shows that those benefits are not being appreciated or valued because the message is simply not getting through. And communicating a benefits program effectively can increase employee awareness and utilisation significantly. So there'll be no need to spend more money on benefits, just communicate them better and engage employees in what you're offering. So from a wellbeing experience point of view as well, there are digital solutions now available that are app enabled and can support specific areas such as mental health, mindfulness, sleep, and physical activity and nutrition too. But apps that are enabling the entire remit of well-being for the individual are now available. And we've just launched an app that caters not only for specific areas, but also for the entire personal well-being experience of the individual. And it's mobile phone enabled, so employees have got instant access, and they can access the content that you are offering and the well-being offerings that you give to employees, but it also stratifies the individual into personality traits and types, which then enables you to communicate with them on a far more personalized level and targeted to the individual and their needs entirely. And that resonates much more then with an increasingly diverse workforce with increasingly diverse needs. For example, employees that are interested in financial budgeting guidance and information will get more messaging around that topic, and those interested in mindfulness and physical activity will get more messaging on those topics as well, and also using terminology that really resonates with the individual and their personality type. There's also social media style chat functionality, and that helps build a community experience, which is particularly relevant at the moment with people being isolated and maybe continuing to be isolated for some time working from home. And that really helps employees to connect with each other, and peer-to-peer communications and support messages are very powerful for employees. And we've particularly found that through this last few months. So moving on to the next slide, I'll summarize some ideas on how using employee benefits and using your program can drive savings into the business. First of all, just looking at some opportunities around global benefits and global purchasing. I mean, if you've got an opportunity as a multinational employer where you can purchase benefits insurance and manage them on a regional or global basis, that can save you significant premiums. I mean, we see typical savings of 10% of premium spend without changing any of the benefits, just by purchasing on a regional or global basis. Looking at your benefit strategy, I referenced earlier a couple of examples there that can make savings of over 25% on converting death and service pensions, or 40 to 50% for limited term income protection schemes. So there are significant savings to be had from looking at your benefit design. Moving to a more employee funded model, talk about flexible benefits and choice. You can potentially, and we're seeing a lot of employers starting to look at asking employees to fund some of the benefits that are available to ease the pressure on the employer and select benefits that are more suitable to the individuals themselves. But also alternative financing and looking at how perhaps the benefits are purchased, and if they're insured, is it the time to look at potentially having them self-insured? Or if you've got a captive vehicle for other insurances, is it time to look at perhaps putting employee benefits, premiums and insurances into the captive vehicle as well? And significant savings can be had from insurers' margins, and it helps to diversify the risk for the captive. So if you've got one, it's worthwhile reviewing whether that can be utilised. So just moving on to the next slide, conscious of time, and just very quickly want to run through a case study for you to show you how it really does work and the value that it can add. So this is for a large global professional services organisation working with 12,000 UK employees. They had a very comprehensive suite of benefits and health and wellbeing interventions, but there was a lack of integration in their strategy, and there was no real strategic use of the data and the MI that they had to hand. So our chief actuary undertook a evidence-based approach and really analysed the scheme's risk profile to look at the claims, trends and projections going forward for potential savings. We carried out market reviews, and we studied linking the data from the different data sets to the broader health and wellbeing initiatives that they were offering as well. And just as some headline outcomes for you, you can see on the right-hand side, we've got some significant savings in terms of 26% reduction in premiums on the staff life assurance scheme. and also a 9% reduction in premiums for the partners, and a significant saving on the healthcare scheme as well from a private medical insurance point of view. 800k saved there with 500k saving in year one and 3 years reduction in administration costs. So significant savings because we were able to analyse the data, look at the risks and apply a much stronger process then when going to the market for terms and agreeing terms with the providers. So thank you very much for your time. Just to summarise, for insurance and risk and HR teams, we would urge you to collaborate, really try and understand your health risks of the employees and ensure your benefit design is fit for purpose and targeting those health risks. And from an employee engagement point of view, you're really communicating in a personalised, accessible and high impact manner. So thank you for your time, and I'll now hand over to Stuart.
That's great. Thank you, Stephen. Thank you, Wolfgang. Some excellent presentations there. We've got a little bit of time now just for a couple of questions. We've had one raised via the Q&A tab. So I think this is probably for you, Wolfgang. How do you record and measure days lost through presenteeism? And what does a day lost through presenteeism actually mean?
Thanks, Stuart. It's always nice to start with a very scientific question like that one. Is quite a challenging one. I think presenteeism is an interesting concept, and you heard Stephen talk about Britain's healthiest workplace, and let's not forget the way how productivity loss has been calculated there is based only on the extrapolation of absences and presenteeism. So presenteeism, how we define it in health sciences, means the productivity loss due to effects of your ill health, often chronic conditions like untreated diabetes or depression. It's not, being at work and doing Facebook or social media. That's a disciplinary issue. But presenteeism is that productivity loss as a side effect of your diseases, if you like. So a fairly abstract concept. But to give an example, good studies would say if I had untreated depression, I would lose 5.6 productive working hours per week. So quite significant. Whereas the same studies say that you and I allegedly procrastinate only 1.5 hours per week. So that gives us an ROI of about 4 hours per week times maybe 10-15% of your employee base. So quite significant. So now, how do you measure it? It doesn't have to be rocket science, but if you want it to be, then please do Google Stanford Presenteeism Scale. That's my favorite questionnaire from University of Stanford. But it's a very simple questionnaire, nevertheless. It asks people stuff like, in comparison to my best performance due to my illness, where is my performance now? And it's an empirically validated question that everyone understands, and there's a number of questions in there. So you can quantify it. But you can make it even simpler for yourself. You could just ask your providers whether in their feedback forms, they often call them evaluation forms, they give to your employees, like an employee assistance program or an occupational health service, etc., whether they are asking any questions that help them quantify presenteeism, and then you just get them to routinely include that in their report that they give to you. So that would be the quick scientific summary, if I may, Stuart.
Great, thanks, Wolfgang. Just time for, I think, probably one or two others. So another one here, probably for you, Stephen, I think. How important do you feel financial well-being is for staff in addition to both mental and physical well-being during COVID-19?
Yeah, I think absolutely essential and very important. I mean, we find, as we mentioned, as we saw on that Britain's Healthiest Workplace slide, that financial well-being is a significant constituent part of an employee's mental health and well-being, and it is absolutely critical to try and support employees with that. We did see an increasing number of employers looking to try and support employees through financial well-being and financial education, and that was pre-COVID. So as we're seeing a lot of employees now with the uncertainty going forward, perhaps being furloughed and hopefully coming back to work, but still with that uncertainty, there is definitely a real need to support employees from a financial well-being point of view, whether that's through education and support material or actual alternative savings offerings and access to perhaps loan repayments that we mentioned earlier on, but critical. Stuart,
can I just very strongly agree with the person who asked that question, because the the aspects they mentioned really all hang together. If you just think of a fictitious case, somebody has financial worries, what would that mean? They get stressed, so that's a mental health issue. If they get stressed, they get sleep deprived. If they wake up the next morning with those very familiar carbohydrate cravings that we have when we are sleep deprived, they might eat the wrong type of food, and over time, to be flippant, predispose themselves to a chronic condition like diabetes type 2. So it's really all hanging together.
Great, thank you. I think we've probably got time. We've had a few submissions in advance, and apology we haven't been able to cover those today, but we'll get back to those. But one that's just come in, I think, will be a good one to cover. Does the panel have any views on how a robust employee wellbeing programme can help professional service firms attract and retain talent?
A good one, yeah. I mean, let me just look at the question again, how robust it is. Well, the surveys that we do at Mercer seem to suggest that people are looking out for health and well-being more than ever, and particularly the younger demographic is looking out for it. And there is a war for talent going on. I know at the same time there is an issue with remaining employed, but the skills you want are people who are keen on health and well-being. And we have a number of studies from our career business that suggests that this is really, really important. And health and well-being, of course, is seen by them as well as an extension of your diversity and inclusion credentials as well. It's seen as an extension of the flexibility and purpose of work that you are able to offer. How much do you allow employees to feel a sense of control and ownership over their work inside themselves? That all plays into then what we might call social well-being and emotional well-being and psychological safety that I mentioned earlier on.
Great, thank you. Well, I'm just conscious of time, and I said we'd finish in 45 minutes. There are a couple of questions we haven't answered, and we'll address those separately after today's session for you. Thank you all very much for taking the time to attend today. Thank you to our speakers, Stephen, Wolfgang, and also I mentioned to Sophie as well, who behind the scenes for our marketing team has been working very hard to put this together for us. We really hope you found the session useful. If you do have any questions, then please do get in contact with me afterwards. Alternative, your usual Marsh contact. A copy of the slides from today will be sent around to everyone who's registered, so you'll be receiving those to look through. Again, if you have any questions that come up from those, then please get in touch. On that note, thank you all very much. Thank you.